Welcome back to York, Carolina. Of course, right now, everyone's talking about the coronavirus, and especially when it relates to those underlying health issues that may make people more susceptible to COVID-19, like heart disease, asthma, things like that. But how does it relate to those with autoimmune diseases, maybe like lupus and arthritis? So that's why we wanted to bring in the expert. We wanted to bring in Dr. HUYNH. He's a board-certified rheumatologist with the Piedmont Arthritis Clinic. Doctor, good to see you. Good morning to you.
Good morning, sir. Thank you for having me again back in your segment here.
Of course. So let's talk about that. People that are suffering from autoimmune diseases, we're hearing a lot about people that have other underlying health issues and how that makes them more at risk for COVID-19. But how does that impact those with autoimmune diseases? Does that also make them more prone to getting the COVID-19 virus?
Okay, so essentially, our patients with underlying autoimmune conditions, such as like rheumatoid arthritis or lupus, they already have a compromised immune system. So based on that, they would be more susceptible to any infection, not just the COVID virus. So we are still recommending the same precautions that CDC guidelines are recommending, such as taking preventative measures regarding social distancing and hand hygiene. But yes,
a lot of your autoimmune patients are taking immunosuppressants because of what they have, which obviously, as you said, makes them more susceptible to any virus. Are you continuing that type of treatment with them, or are you doing something different during this time where everyone's at greater risk?
Yeah, so not necessarily different in terms of their medications. Right now, we're still recommending that our patients stay on whatever regimen that we currently have them on. We're very good at advocating and educating our patients about what to do when they come down with any infection, not just the COVID virus. But since the COVID is another type of infection, they would still take the same precautions we recommend regarding any infection they may come down with. But until they have an active infection, we don't recommend discontinuing or interrupting their current therapies. Unless they do come down with an infection, then definitely notify their primary care doctor or us, and we can give them further instructions from there.
It's great information. And the Piedmont Arthritic Clinic you guys are still treating patients in the clinic. What type of precautions are you guys taking to keep people safe? Like you said, you're always dealing with people that have a bit of a suppressed immune system. So a lot of the precautions that a lot of us now are taking as a way of life are probably something that you guys have been doing all along.
Yes, so as far as our office, we're still open. Our patients, a lot of them are on infusion therapy, so a lot of them, they can't really have interruptions in that therapy. But for patients that do come into the office, everyone is getting screened for any potential fevers they may have, so we're doing temperature checks. Regarding the waiting rooms, we do clean it down very frequently, trying to disinfect and sanitizing it. We have the chairs spaced out 6 feet apart the best we can. As far as check-in, check-out, we do have the 6 feet rule as well, where we have patients give each other their space. Regarding our exam rooms and all the materials and furniture we have in the office, we definitely try to disinfect and sanitize very frequently throughout the day to make sure that our patients are safe from any potential harm when they do have to come in for their appointments.
It's great to hear that, because a lot of those patients obviously depend on your care to keep their quality of life going as well. So it's good to hear the precautions that you're taking there. I'm probably going to butcher the name of this medication, but it's been talked about as a possible treatment for the coronavirus. It's called Plaquenil. Is that how you say it?
Yeah, it's called Plaquenil. Plaquenil is the brand name for the generic, which is hydroxychloroquine.
Okay.
The majority of a lot of our patients are on Plaquenil therapy, since we treat conditions where they have FDA approval for, such as lupus. Regarding our patients with lupus, Plaquenil is definitely considered a cornerstone therapy where they should be on it unless there's a contraindication. Regarding the use for COVID, there's still extremely limited clinical data regarding its effectiveness. So right now there is one clinical trial that is undergoing for patients hospitalized with COVID. But outside of that, there's still, like I said, very limited clinical data. So we're not recommending patients or people, for that matter, using it for prophylactic measures, meaning going on it just thinking it will help prevent getting the virus. Pretty much there's nothing to do to prevent the virus, only preventative measures, such as the hand hygiene and social distancing.
And we've heard, of course, the president talking about the, the hope that they, and how they hope that that is turns out to be something that can be used. And a lot of people have heard that it's been used to treat malaria and other things like that. So lots of trials hopefully going on to see if it can potentially help in this case, but we will see.
Yeah, hopefully we'll limited studies right now showing effectiveness, but right now in order to do a clinical trial, you have to see the safety and the effectiveness as well. But right now we're not recommending people go on Plaquenil just because they think it can help prevent the virus.
Great points as well. So people can always go to PiedmontArthritis.com. Again, Dr. Wynn Duck, he is with the Piedmont Arthritis Clinic. Thank you so much. Stay safe to you and your family, and hopefully we'll get to see you here in our studio sometime real soon.
Thank you, sir. I wish the safety of everyone at your studio as well. Thanks for having me on TV again with you.
Thank you so much, Doctor.